Okay, guys, today talking about promethazine. I'm actually a very big fan of this drug, although you do need to know some of the bad things that do. And again, um, so what we're trying to say is I love phenergan. Okay. Again, promethazine hydrochloride is the known. That's the generic, but we call it phenergan. Okay. That's what we usually say, and it's used to prevent and control nausea, vomiting. It's also pretty good for motion sickness, and it's also pretty good at allergic reactions as well, something that they probably don't tell you. But again, phenergan is, again, incredible drug. It's not just an antiemetic. It is a good antihistamine. It helps your antipsychosis. It's an antipsychotic drug as well. And but one of the things is it's a phenothiazine derivative. What does that mean? That means that you can have a dystonic reaction from it, so you really got to be careful with it. Again, it competes for the H1 receptor sites. That's how it works. And again, it's really good. It's great as a sedative, actually. Usually, if you got somebody that's just kind of wigging out and you need to relax them and they're a little bit nauseous, you give them the phenergan and boom, and have a nice day, and they just relax right out. And at low doses, it's relatively free of extrapyramidal effects. That's the key thing to remember. Give it slow. Give it in low doses. It actually works really, really, really good. The problem is the paramedics usually like to give 50 milligrams of it, and they like to slam it, and that's where you usually end up with your dystonic reaction. Usually less than 1 minute for duration, and then 4 to 6 hours is how long that it works. I know that this stuff puts me right to sleep. I love it. I mean, absolutely love it. Again, nausea, vomiting, motion sickness, it's really good for that. Anything of a apprehensive type, mild anxiety, it actually works halfway decent for. And for sedation of OB patients in labor, they can give that to them. So again, the thing that you got to watch out for is all of your extrapyramidal syndrome effects, the sticking out the tongue, turning the head to the side, torticollis, any type of ringing of the ears you have in there. They may actually go hyper excited. That is one of the side effects of it that it can happen. It can cause hallucinations, and when you see somebody on a phenergan trip, I got to be honest with you, it's quite interesting. We had a case where we gave some to one of our mates that was puking at the station. Gave her 12.5 of phenergan, and holy Toledo, Ohio, she started hallucinating big time. And as a matter of fact, we had to drive her home that night. It was pretty brutal. So again, it can cause some blood pressure to lower, a little bit of bradycardia there. It can go either way. If they get excited, they usually get tachycardic on you. And again, it can cause a little bit of cardiovascular depression. But I will tell you, it causes a whole lot less than them actually retching and trying to puke, okay? And one of the bigger reasons that I give it is because you got somebody that's just sitting there dry heaving. And especially if it's a cardiac patient, you probably don't want them to do that. Watch out for your extrapyramidal syndromes with high doses. If you're going to give a high dose, give it slow and give it maybe in 2 or 3 shots. Okay? The use in children can cause hallucinations, convulsions, and actually can cause sudden death. Hello, that's not a good one. Okay? So again, these are some extrapyramidal things that you might actually get to see. The foot twitching, the fasciitis, the feet will come up actually. They'll stick their tongue out. That's actually a pretty funny one. They'll start twitching their head. It's actually fun to watch. Again, if that happens, benadryl, 50 milligrams of benadryl works really good. Stops that from happening. Okay? Again, you don't want to give it. If they've got peptic ulcers, stay away from it, especially if they're hardening peptic ulcers, bleeding peptic ulcers. You want to stay away from those. If they're comatose or they're obtundant, probably don't want to give them this. Bladder neck obstructions, this will cause urinary retention. So if they've got some problems down there, you definitely don't want to give any type of phenergan. Watch for signs of Reye's syndrome. Watch out for those. Scott's, what are the signs of Reye's syndrome? Again, very sleepy, very, again, that twitching effect that go on. Let's see here. Relative, if they've got cardiovascular disease, I think that's kind of an iffy one. Any liver function, it is processed in the liver. They got narrow angle glaucoma, you want to stay from it. And pyloduodenal obstruction. So if they've got any type of bowel obstruction, stay away from phenergan. It is not your friend. It's going to make things a lot worse. All right. It can increase, prolong, or intensify sedative actions, okay? Especially when you give it with a barbiturate, when you give it with a general anesthetic, any type of narcotic. It can actually enhance the effects, okay? You got to be careful. You can increase the chances of extrapyramidal syndrome if they're taking sort of psych drug, any monoamine oxidase inhibitors. We all kind of, if you notice a lot of our drugs, they say, yeah, be careful around those. There's a reason why, okay? They don't play well with other drugs. Patients that got asthma, peptic ulcer disease, bone marrow. The reason with asthma is you can actually cause a bronchospasm with this, so be careful. Don't use it in children with vomiting or of unknown etiology, because, again, usually there's something else going on. And arterial injections, you don't want to give it in an artery. You will kill the artery. One other thing with this is make sure that you got a good patent line on this. If you do get a extrapyramidal syndrome, 12.5 to 25 milligrams of benadryl as needed, you might have to redose it because the benadryl will wear off before the phenergan wears off. It usually comes in a 2 milliliter ampule, 25 milligrams in each ampule. We usually give them half of that, nice and slow. Actually, we kind of prefer to give it IM so that you don't have the problem. It kind of slowly absorbs. However, it does cause tissue necrosis, so make sure you go into a nice big muscle. Going into the deltoid's not a good idea here. Again, we usually don't use it under 2 years of age, and 0.5 to 1 milligram per kilogram up to the adult dose, okay? And to be honest, guys, pediatric dosing, I usually go Zofran on them just because it's a little bit safer drug. Again, your routes, you're going to give it slow IV push over 3 to 5 minutes, or you can give it IM. Just make sure it's a deep IM injection. That means in the butt, in the top of the legs. Again, the pregnancy category, you can give it to pregnant patients. It does help sedate them a little bit. You can use it for that. All right, that's it for phenergan. Again, that's kind of, if I'm puking, please give me phenergan. That's just a personal thing. The fact of the matter is I think it works a lot better than Zofran. But again, it's got a few more side effects than Zofran, so it kind of depends on your patient. All right, we'll talk to you on the next one.